And Dr. Dan Tomlinson's joining us now. Thank you for being here, Dr. Dan.
Great to be here. We've got some pregnancy stuff tonight.
All about pregnancy tonight.
Right.
First question, is it okay to sleep on your back during pregnancy? Is it dangerous for the baby?
Okay, we'll get that question all the time because it's really kind of an urban legend. The answer is it is okay to sleep on your back, but the books don't say that. And the reason they don't say that is because in labor, we sometimes see that women, when they're laboring on their back, will have heart rate decelerations. And so we switch the patient to their side, and lo and behold, everything's fine. So it's been extrapolated by people who really aren't scientists, but sometimes write those books, that you can't lay on your back. And so women really are kind of worried about that. They start out on their side, and there's the rub, because you know how it is. You fall asleep and you turn into your back, and then gals will wake up on their back and kind of be worried. Well, the answer is it isn't a factor for pregnancy, as it is sometimes in labor. So the way we know that is because we've interviewed women on how they sleep, and then you look at the outcomes prospectively, and they're the same. So we can't really promise women a perfect pregnancy and a perfect delivery, but we can say the outcome is not related on how you sleep. So that is really good news, because a lot of people, and they read it in the books, saying you can't sleep on your back, and the answer is you can.
Okay. Another question, is caffeine okay during pregnancy? I know
There's
you probably get
one.
this a lot.
That is so common too. Now, caffeine is definitely a drug. It's the world's most commonly used drug, and probably more pregnancies have been exposed to that than anything else. So unlike smoking, marijuana, tobacco, alcohol, methamphetamine, caffeine is a drug that we really don't have too much of a problem with. There's been 2 studies that there might be an increase in miscarriages, but we're talking of billions of pregnant women exposed to this drug. So I think, like the book says, everything in moderation. It doesn't cause birth defects. It doesn't cause preterm labor. It doesn't cause bleeding. It doesn't cause hypertension. So you can do caffeine in pregnancy in moderation. In fact, it's a great medicine for headaches.
And a couple of cups of coffee.
Right.
Yeah, a couple cups of coffee would be what I would say to do. I wouldn't do a whole pot of coffee a day.
Perfect. Thanks, Dr. Dan. Dr. Dan joins us each Monday to answer your medical questions. If you have a question, you may write or email him at the addresses on your screen. You may also post the question on our Facebook page. We'll be right back with more News 10 at 5.